Well, hi, everyone. My name is Judy Roitman. I'm the director of the Tennessee Healthcare Campaign. I have a couple of slides to talk about volunteer opportunities. I'm also joined here by a couple of our staff members, Tom Savage, Byron Elam, and Andrew Hawkins. So I hope they'll jump in and chime in as needed. And we'll have a lot of time for questions too. I'm going to share my screen. Y'all see that?
Yes.
All right. Tennessee Healthcare Campaign absolutely depends on our volunteers. We have real ambitions in terms of what we see needing to happen in Tennessee, and a tiny little staff, and our volunteers just make the whole thing work. We've got three major initiatives. We've got enrollment, we've got advocacy, and we've got education. And as I said at the beginning, our mission is working for affordable, equitable access to quality health care for all Tennesseans. Just in the last year, we became a nonprofit insurance agency. People can call our 844 number and get connected with a licensed nonprofit insurance agent. Andrew's on the call here. And our goal with this program is to help people enroll in TennCare, help them enroll in the Affordable Care Act, healthcare.gov plans. And even if they're not eligible for any of that stuff, to connect them to community resources that can maybe ease their situation a little bit. We absolutely depend on volunteers for this program. First of all, to get the word out, and people can do that in any number of ways. Going to a health fair. We recently did that, had a booth at the Knox Oak Ridge Labor Council with volunteers. Also, any vaccine events that we're doing, we're going to have outreach, enrollment outreach, or they can just get the word out to their own church or their own friends, or take a stack of cards or some posters and put them up around town. We also really depend on phone volunteers during open enrollment. So people call the 844 number, they get a volunteer answering the phone and doing a little basic screen to see if they might be eligible for our programs, and making them an appointment with a licensed agent. And that's really rewarding work, to feel like you're connecting someone to the care that they need. The open enrollment starts November 1st and goes to January 15th. And we'll be doing some volunteer training and getting the volunteers going in mid-October. So this is all coming up real soon. Some pictures of some of our enrollers. One thing I wanted to point out is that a lot of the people who need our services are people who are recent immigrants, or who don't have access, don't have broadband, don't have computer skills. And so, you just heard the director of TennCare say they've got this website, which is great, but for a lot of people, that's really a difficult lift, a difficult hurdle to deal with. And so we're there to help people with that. In terms of advocacy, we're advocating for Medicaid expansion. We've been advocating for Medicaid expansion for a while, but I feel like we've got some new things that have lit a fire under that effort, including the federal effort going on right now to expand Medicaid. And we're trying to build coalitions. We're trying to find people with stories about how Medicaid has affected them. And we're trying to influence decision makers, and we need all hands on deck for that effort. We're looking for stories of people who've been impacted by Medicaid, either who depend on it for their life or who can't get on it and it's impacting their health. We want to lift up those personal stories so that people understand we're not just talking about statistics here, we're talking about our friends and neighbors. We have a committee that's working on the problem of rural hospital closures. Tennessee has the highest number of rural hospitals in the country per capita. And we did a report that we released just last spring about the causes of rural hospital closures. Medicaid expansion is one, but not the only one. We're trying to build coalitions in rural areas to work on the problem of rural hospitals. And the committee is also starting a new project to research success stories and get those out so people can get an idea of what to do about the problem. These are some pictures of the wonderful volunteers on our rural hospital committee. You are in the middle of one of our education efforts. We try to do an annual health policy conference, and sometimes we also do webinars throughout the year. We have had an incredible bunch of volunteers putting together this conference today. Jacqueline Dalton chairs that committee and definitely needs help. If anybody's interested in working on education, we can get you connected with that. And the newest effort, vaccine equity, we are working with ambassadors to get the word out about the need for vaccines. We are going to need volunteers to work at pop-up clinics and to spread our PSA messages on their social media. Lots of volunteer effort needed there too. So I'm not sure who all is in our group, but if you want to unmute yourself, and I see Andrew's got his hand raised, so why don't you start us off, Andrew?
Okay, Judy, I was just going to go back and talk about the volunteers you brought up about the 844. It's actually a lot more expansive than that. We have our volunteers do what we call pre-enrollment assistance. They'll call the 844, they'll schedule the appointment, and then we'll actually have one of our volunteers call them the day before the appointment and remind them of the resources they're going to need, like knowing all the birthdays, socials, and any documentation they're going to need for the appointment. And then we have something called post-enrollment assistance. We got great feedback on this last year. What we did was right before open enrollment ended, we had our volunteers call all the people that we enrolled just to make sure they paid their premium, make sure they got the right plan, made sure that if they needed to find doctors or help looking at medication, the volunteers would schedule them with me or Meryl. And that's kind of what made us different than other insurance agencies. We're an old navigator program. We were part of the Get Covered Tennessee, but whenever they shrunk that grant, Family and Children's Services had to relieve of our partnership. So that's why we became a nonprofit insurance agency, so that we could afford to keep on staff me and Meryl Rice. But we've gotten great feedback from this. If you know anyone that would want to help with this, it's very fulfilling. I mean, we're even getting stories. I mean, you're feeling like you're having a true impact on people. And believe, I know it seems like it wouldn't be that big a deal, but people love to tell their story and just how much they appreciate our work.
Thanks, Andrew. So Stacy and Terry, do you want to jump in and ask any questions for us?
Hi, thank you for the presentation. My question was just going to be, how do you register to volunteer? But I noticed that it was the email address was entered in the chat, so I'll plan to reach out later today to register to volunteer.
Great. Stacy, what's your interest?
I'm interested in the pre-enrollment volunteering, so helping people determine if they are eligible and then connecting them to those resources.
Great. We definitely can use your help. Terry, I don't want to put you on the spot, but do you have any questions, or what are you thinking about volunteering?
I really don't know because I have a lot of trouble talking sometimes because of my allergies. So,
Okay, I'm sorry. Didn't mean to put you in a difficult position.
Yeah.
But thank you for your interest. Michael just joined the call, and Michael is our volunteer board treasurer. Michael, do you want to jump in and say anything about volunteering with Tennessee Healthcare Campaign?
Well, can you hear me first?
Sure
Yes.
can.
Okay. One is it's really exciting to work with the Tennessee Healthcare Campaign, the board and the staff. People are very knowledgeable and really dedicated, and it's a pleasure having you on board as our executive director now. I'm rolling off the board at the end of this calendar year, but I expect to continue as a volunteer in one or more of our committees. And it does, people can volunteer to be on committees even if they're not on the board. And often that's not known. And there's a lot of work to be done to bring Tennessee up to par as far as coverage for healthcare. So I would encourage anybody that has some time, even if it's limited, to contact Judy and make her aware of the time that they have available, and she could slot you into a volunteer position that would serve our community. Judy?
Thank you, Michael. And I should have mentioned that we are actually recruiting board members right now. So if anybody's interested in being on our board, definitely let me know, or if you recommend someone else to be on our board. I also should probably mention that we're planning a training for people who want to help with enrollment. And Tom, you want to jump in and talk about that?
Yes, we are seeking people to we're doing our training as we gear up for open enrollment, and we're going to have 2 sessions in October, I think, one early October and the final one as we get ready, as we close in on the November date. So really want to shore up those numbers and get those volunteers. We're working to purge our list of volunteers to see who's going to stick with us this term and actually try to fill in the slots. So hopefully with this open enrollment and with the extension of it, and we know the areas that are targeted, and we know the need of the people in those areas. And our test run was all of this year, and so we kind of have a small template that we'll kick that off and go for it.
Hey guys, can I just say one other thing?
Absolutely, go for it.
Yeah, with volunteering, we can't train CACs anymore because we became a nonprofit insurance agency. So we can't have you assisting people signing up for Obamacare, the Affordable Care Act, but we can train you on how to enroll people into TennCare. And as you heard with the director, they have no idea what they're going to do when all those redeterminations come in. And we're probably going to need volunteers to help me, because I'm the only one at THCC that continues to do TennCare enrollment. And last time this happened back in 2 years ago when they came out with TenCare Connect, I just got flooded with I was doing like 15 TenCare appointments a day. So if we can train people, it's really easy to do. TenCare Connect is a really easy system. It has you check your answer basically after every screen, just so you don't make a mistake. But I've been doing this for, again, 7 years. And if there's one thing I know, it's how to apply for TenCare. Thank you.
So one thing that people can do really easily is get on our website and send a message to their senator or congressperson, letting them know that we need Medicaid expansion. And I'm putting that link in the chat too, because that's a real easy way to volunteer. And it's important for our federal elected officials to know that this is an issue that's really important to us. And I know people get discouraged with the partisanship around this issue, but I feel like whatever party the elected official is in, they represent us and they need to know what we need. So, so I would urge you to do that, even if you feel like it's a waste. Do it anyway, because they need to hear from us. And I don't think it's a waste. I think there's a real possibility that we could have a federal solution to Medicaid expansion in the next couple of weeks here as part of the reconciliation bill. So time for a big push on that.
Seems like we got a couple things going that are positive. If we can get just one, we'll be happy campers. But I agree. Until then, we have to continue to engage politicians. They may be partisan, but we're not. And that's why we have this this series of meetings going with the Speaker of the House, Cameron Sexton, to continue to ask for his support for Medicaid expansion and give him examples of why it is needed. And he's open to talking to us, and we just got to really stay on top of it. So excited about our next opportunity to speak to him and any other politicians throughout the state.
Right. I mentioned the federal effort, but we are still really pushing the state of Tennessee, and that won't happen until they go back into session in January. But now is a really good time to reach them when they're home in their districts and not quite so busy. So interested in talking to people about how to approach those legislators as well. Byron, we've just got a few more minutes. Do you want to jump in and offer anything about volunteering?
Well, I guess any, we do have our vaccine ambassadors who are helping us. Any help that you can provide, or any connections you can provide regarding, vaccine events, or things we should know or be aware about, or be aware of, be extremely helpful to us as we try to get the word out about vaccinations.
Great, thank you. So I think we're just about done. I don't know. They said 2 more minutes. Any last questions? I think it's okay for us to end early and go back into the main session. If you want to click on the leave room at the bottom of your screen.